Welcome back, little helpers. Today we will be talking about resilience. And we have a special guest for this. This is Dr. Kate Lund, who is a licensed clinical psychologist of 17 years, peak performance coach, best-selling author, and TEDx speaker. She has a personal story that is really powerful and I think will help contextualize why we're talking about resilience today. But I mean, this is a topic that applies to every single one of us. And I think especially when we have friends and family who are struggling, it's almost a gift we wish we could give them. Like, please hang on another day. Please believe in the future. And so I think in this talk, this is very, very relevant to those of us who have people who are struggling and who are struggling ourselves. So Kate, welcome.
Thank you so much for having me. I really appreciate it.
Well, thanks so much for coming on. So do you want to start by telling us your background, how you came to this topic?
Sure, absolutely. So it goes back to the point where when I was 4, I was diagnosed with a medical condition called hydrocephalus, which is essentially when the cerebral spinal fluid isn't circulating as it should and pressure builds up on the brain and just, in a nutshell, get really sick. And that's what happened to me. The symptoms came on somewhat gradually, but when, the pressure had built up to a certain point, I was no longer that typical active, happy little 4-year-old anymore. And it took a while for them to figure out exactly what was going on. So it was a bit of a process there, very stressful for my parents. My older brother, I had a brother who was 3 years older than me, and it was hard to kind of watch this, I imagine, unfold. I know that it was hard for me, but for them, it was very hard as well. Good news is hydrocephalus can be managed with something called a shunt, which is essentially a drain which circulates the cerebral spinal fluid, which isn't circulating on its own. Problem with that is they have to be fixed, they break, that kind of thing. So a good portion of my childhood was in and out of the hospital, surgery, coming back to school with, half a head of hair and just feeling different, being different, and having to kind of navigate through those moments. So that's sort of the story in a nutshell. And in essence, I was extremely fortunate in the way things kind of progressed. I mean, I had lots and lots of surgery in those early years. But I was fortunate. I was able to bounce back each time.
So feeling like you didn't fit in, obviously it's such a hard time to be different is childhood and adolescence. So, were you quite lonely during that time or embarrassed or anything like that?
I was really, really fortunate in that I wasn't lonely because I had a group of really close friends who, supported me regardless. That being said, it was hard feeling different, because there were other, kids in the mix, obviously, who didn't really understand what was going on. And so there were a lot of, mean and biting comments that caused me to feel pretty set apart, particularly in sort of that early adolescent kind of time frame when, boys can be particularly mean. Girls have their own tendencies to be a bit mean. And if a kid isn't sort of fitting into what's considered typical, that can kind of trigger some of that meanness. And that definitely was my experience. But, again, I had that foundation both at home and at school that really, really helped me. And the other thing that helped me was I was a tennis player. I was able to really play tennis and play it pretty well because that was sort of what I focused on, because there were so many things I really couldn't do because I had to be careful, no contact sports, nothing that, there was a risk of falling and hitting my head. So a lot of the typical activities that, you might find kids doing, like jumping on trampolines and hanging upside down from the swings on the playground. I couldn't do any of that stuff. So to kind of focus in on what I could do. And tennis became a really important piece of my identity back then, helped me to connect with a lot of different friends and stuff like that. So, that was helpful for me, despite those hard moments of, feeling like an outsider, feeling like, I didn't fit in. I looked different, felt different, fell behind in my work, all that stuff. But, had support to help me kind of move forward.
Tell us what that support looked like. 'Cause it sounds like you had friends and and family to support you. What, um, how did you think it affect them? Like, did it affect your family? But also, like, what did they do well?
Yeah, it was really, it definitely affected my family. It was very stressful for the whole family system. Obviously I wasn't thinking in those terms when I was a kid, but looking back, absolutely. And the thing that I believe my parents did well, my brother did well, it was my immediate family, is they, helped me through the hard moments. But when things were going well, when the shunt was working, when, it was kind of status quo, going to school, getting up. I was expected to be, a fully functioning member of the family. I had to do my chores. I had to meet expectations. I had to get my homework done. There wasn't any like, oh, but she can't do that because, and of course, when I actually couldn't do it, sure, that was true, and I couldn't, and I had the support and all of the things that I would need to get through that. But when things were moving forward, status quo, the expectations were just as they were for everybody else, and I think that not dwelling on the aspects of me that were different and set me apart on a continual basis was really important. Because it helped me to internalize, you know, what I could do as opposed to what I couldn't do. What helped me get in touch with my strengths and use those to my advantage. And I'm not, trying to sugarcoat it and say there weren't hard moments, because there were lots of them, but these were the things that really helped with that.
One thing that this is actually brought up by a fellow therapist. She had a concern that a child she was seeing had almost a sick identity. Yeah, so basically, I mean, parents being so concerned that the child was ill in some way, and doctor's appointments, or they were like rewarded. It would be the times when she would get closeness with certain members of her family, would be like surrounding doctor's appointments, and so that this became like this integral part of identity. Is that something you see?
That definitely can happen. And,
Mm-hmm.
it's hard because to be kind of stuck in a sick identity, I really believe is a big challenge for kids, because it really holds them back from maximizing their potential over time. So it definitely, can be a thing. And that's the piece that I believe my family did so
Mm-hmm.
well was, they really I think went to the other end of the continuum to make it so that didn't happen, that there was no sick identity. They wanted me to, and they did see me for the child I was, as opposed to the condition I happened to have. And that was really, really helpful. But, everybody kind of handles things differently. And, that piece, because, I definitely had, moments, and, when I had to go to the hospital for checkups, or, go to eye therapy or whatever it was, I had outings to McDonald's and all that stuff, but I didn't, I think I would have rather been in school,
Yeah.
um, as opposed to, but that was just me. But yeah, that's definitely a thing that can happen.
Well, that's great that your family was able to strike that balance, because I sometimes wonder this myself, where there's like that ableist movement of like how much, if someone has an illness, mental illness, physical illness, or anything like that, how much are they expected to kind of fall in line with the mainstream, like treated as normal, same expectations, um, go and do the chores and school just the way all the other kids do it, or and how much do you um, accept and accommodate someone's like limitations at the time? And it's a hard question, right? So I'm curious how your family did it well, where you said that you were treated like a kid that you were, but when you couldn't, you couldn't.
Right. Yeah, exactly. And then also, I think it's really, really important to be seeing all this within the context of one's own unique context, right? So the illness or the, physical illness, medical illness, mental illness, what have you, will definitely be a defining feature of one's own unique context. And I think that definitely has to be taken into account. So it just so happened that, my context, when things were going well, I was able to do the chores, be in school. I was, get my homework done, all of these things. If there had been some limiting factor in there, I'm sure that would have been attended to. It's really understanding who a child is, what is their own unique context, and sort of help to foster potential within that context. And not, no two contexts are going to look the same.
So you're talking about really emphasizing what they can do and sort of, I don't know if you mean de-emphasizing the things they can't do, but maybe just put spotlighting what they can do.
Spotlighting what they can do. You definitely don't want to ignore what they can do. I mean, you got to acknowledge the challenges. You've got to manage through the challenges. That's a really important piece of the puzzle. But really highlighting what kids can do, as opposed to always falling back on or dwelling on what they can't do is very, very important.
I mean, I guess that process might just be the answer to my own question, but I just would imagine it would be so hard to get people to budge out of hopelessness for a very long time. So how do you kind of foster that sense of acceptance, or how do you get them ready to think about, okay, well, I can't do this anymore, but I can do this?
Right. And that's a really, really great question. And, it's a process that has to unfold over time. And, let's say that somebody's function or abilities shifts, in mid-adolescence or, mid-childhood, where they've established an identity around being able to do certain things. And then all of a sudden they can't do them. That's a little bit of a different scenario than what I experienced because I was so young when this all unfolded, and it sort of was my norm for the duration. But the process of, helping one to create a new sense of normal is very similar. You sort of over time, as they're ready, sort of try to highlight and pull out, what are your strengths? How can we help you to use those to your advantage? What are the things that you can still do? Or how can we, help you do relatively the same things from a slightly different angle, that sort of thing. It's about helping to create a sense of pivoting and adapting over time, but definitely not a one size fits all. And not an easy process by any means.
Help the listeners who are thinking, like I am, like, how does one do that? Like that sounds, that sounds awesome, and it sounds like the right thing to do. I imagine when you're a parent or loved one and you're exhausted, you have your own stuff going on, you just want to help them, but like you move, get the day done. Can you give me a picture of what that looked like for you? Like a moment that your family really stepped in and helped you, leverage your strengths?
Or what you do with clients.
Right. Yeah, absolutely. Because it's a process, right? And not an easy one. And I wish there was a button that we could push, but there certainly isn't. So it's a process that has to unfold over time. And I think that, it's for me, it was, being treated as able in most ways. That was for me what worked. Doesn't work for everybody because maybe that's not the case. Maybe there's been an injury which has left a child in a wheelchair, that kind of thing. So that process is going to unfold a lot more slowly. And it's the same process though. It's, if a child is developmentally in a place to kind of have a conversation about it, is sort of helping them to pull out, okay, so this is going to look different, but how might it look? Sort of creating a picture of what the future could look like, and then pulling out the pieces of the picture, the strengths, the things that are going well that can help that picture become a reality. If that makes sense. It's really through pulling those things out that will help move a kid forward. And that is going to look different for everybody. And in terms of the exhausted caregiver, the exhausted parent, because that's real too, right? Regardless of what's going on with the kid, self-care, managing stress response, putting yourself, again, easier said than done, in a position where you're able to move through and beyond the challenges that are going to come up without intensifying or escalating so much. It's some sort of a mindfulness practice, or daily exercise, or what have you, anything that's going to help the parent or the caregiver to manage that stress response so they don't get overwhelmed to the point of shutting down.
Can you give us an example, either in your clinical work or your own life, what that has looked like, successfully or not successfully, just so people can be like, oh, yeah, that's what it looks like?
Sure, absolutely. So let's just say that, a caregiver or a parent isn't managing their stress response, and something comes up with their kid, and, they escalate, the level of intensity will escalate to the point where they can't function. Right. And I've seen that happen time and time again in my clinical work with parents who are grappling with very, very difficult situations with, their kids. So what that looks like is, encouraging that parent to get, their own therapy, encouraging them to engage in some sort of technique, whether it be mindfulness, meditation, yoga, exercise of some sort, something that's going to help to quiet their mind and body consistently. So it's not, as you guys know, like a one size fits all. It's not a one-time situation, but helping them to create, this parent caregiver, create a routine that's going to help them modulate that stress response so they can better manage through the challenges that are coming up with the child, which will then allow them to help the child see what's possible for them on the other side of the injury or illness. Does that make sense?
One thing that I've actually been recently struggling with patients is, and it's because I just don't know this world very well. So people who have some kind of chronic condition, and either they haven't figured out what it is, or maybe they have, but they're really struggling with feeling invalidated by doctors and nurses. And then, it's hard for me as the provider to know what's truly going on. And I have doctors in my family, and I know they can be very invalidating. And and so I'm just kind of wondering about that piece. If you've experienced much of that, how to keep people, how to help them advocate for themselves, keep resilient, or yeah.
That's a really, really good question. And clinically, I've worked a lot with that kind of a scenario, and it's really hard. I mean, there are no easy answers, right? Because you've got your client who is really authentically struggling with this lack of validation, with these questions. Maybe it's kind of a group of symptoms or an illness that's come on relatively suddenly, no answers, really hard to live in that space. I think it's important for us as clinicians to, really validate the experience of the client, around what's going on, even if the answers aren't clear. But letting it sort of unfold to the point where we can understand as well as we can. But I think that authentic human validation of the experience, regardless of what the sort of objective markers are, if that makes sense. But I think that's a very, very important piece of the process.
Do you, from the practical hospital side, do you have any idea like what people can do, how they can advocate for themselves in different ways, what behaviors might get them better answers or a better experience? Or is it just totally
So hard because the
Yeah.
healthcare system is so hard in
Hmm.
general, particularly now. I really recommend that folks just keep asking questions.
Hmm.
Don't be afraid to seek another opinion,
Hmm.
but really just keep asking questions and ask for and build a support team around them to help bolster them in that process. Bring somebody to appointments,
Okay.
have them have that other person take notes to really try to understand at a deeper level what's going on, what's being said, because folks in that kind of a situation can often be very, very overwhelmed. They're not feeling well, they're in
Hmm.
pain, whatever it is can really filter what they're hearing, right?
Yeah.
So having support in those moments is really, really important.
Okay. Well, thank you.
Sure.
I guess another thing I'm wondering, I mean, I know you interned at a burn clinic, a pediatric burn clinic, and when I imagine that, first of all, it's my worst fear. I can't imagine the sense of loss of belonging and of fear of rejoining others.
Right.
What do you do about that?
Yeah, it's not easy, right? It's
Hmm.
and so with burn injuries, it's getting through that very critical acute phase.
Hmm.
Oftentimes the child isn't even awake during that phase. They're in a medically induced coma or similar state. So it's sort of helping the family grapple with and cope with what's happened. Then the rehabilitation phase comes about. That's when those questions start coming up, because there's oftentimes a complete shift in physical appearance,
Hmm.
physical ability, all of those things. So it's bringing in, again, a really strong support system to help the child to come to terms with what's happened, all those changes, and in time start to build a foundation for moving forward back out into the world. There's often a very important component, a team of psychologists or caregivers going out into the school to help educate the teachers and the staff and the peers on what's happened and what they might notice when the child returns, that sort of
Hmm.
thing. But coming at the supports, building a support structure around the experience from multiple angles. So you have, a psychologist, maybe a music therapist, maybe in cases where it's okay from an infection standpoint, a therapy dog, those all just sort of a multimodal approach for creating a foundation of support that works for the child. But it's a process, and there's really not a one size fits
Yeah.
all. But I went out into the schools a lot to kind of help pave the way for the child to return.
Do you notice in caregivers of a child or other loved one who is struggling with an illness or condition like this, do you see particular mental health struggles in them? Because I imagine I'm picturing building that support team around the child, and then the caregivers might tend to focus everything on them. And I know you're saying that they need to take care of themselves, like, therapy, but do you see like common struggles, common things that happen to them, things that happen to them they might not even be aware of at the time?
Yeah, absolutely. I mean, so the self-care piece is really important, sort of self-care for the caregiver. But really what I see a lot of, and I know that went on in my own family, just this idea of overwhelm, feeling just bogged down and overwhelmed by the gravity of the situation. And the coping piece is really important there. What I see clinically a lot on top of sort of the overwhelm and the whole the weight of the situation, caregivers can easily develop their own anxiety disorder, or you know, depression, symptoms of depression, mood related issues as a result of what's going on. And that's where the self care piece, the therapy for the caregiver, the opportunity for an outlet beyond what's going on is so very important. But again, there are no magic answers in it. It's a process that has to unfold in a way that makes sense for each unique situation.
Yeah, I'm a new mom, so now I have a little bit more perspective of wow, it's already so hard to raise a kid, but also, but I can imagine that anything happens to them, even if it's not their fault at all, you feel so responsible. You feel like it's already an uphill battle for parenting, and then that makes it even steeper. And I can imagine, like myself, I'd feel like guilt or
and horror, and yeah,
sure, absolutely. And so and that's particularly in the burn injury domain, sort of helping parents to work through that horror, that shock, that disbelief in terms of the situation that's unfolding.
Yeah. That's truly just an awful, I don't know, just an awful thing to imagine. And being, a horror associated with your own child too. If we zoom out, so we've been talking a lot about kind of the medical side, but resilience is just such a broad topic and applies to everybody. So are there kind of broad principles? We started with focus on what you can do. What other kind of principles apply to this topic?
Absolutely. And of course, resilience, is important for all of us across lifespan and domains and such. And so, all of the principles of resilience that I outline in my book, are important to think about, so it's, kind of believing in what you can do, seeing possibility on the other side of challenge, focusing on strengths and helping, our kids and, all of us to foster those strengths while acknowledging the challenge. You want to, courage is important, the courage to step outside of your comfort zone, to take calculated risks, which makes sense within your own unique context. This concept of failing and having things not work out the first time or second time or third time, really important experience when it comes to resilience and our kids in general, because, things aren't always going to work out the first time. And we've got to be able to, pick ourselves up, move forward from a slightly different angle, and give our kids the idea that that's not only okay, but it's vital for them to succeed down the line. And I think that's an experience that, kids who are grappling with a challenge early on experience more readily in many cases, right? I know I did. And I know that I had friends who, everything came pretty easily to them at the get-go, but that didn't benefit them in the long term, in the long run, right? Because there came a time when things got much harder and they didn't have the memo yet that, oh, shoot, I better work harder to compensate for that thing, that sort of thing. So I think early failure, early kind of needing to grapple with problems, untangle problems independently without someone swooping in to fix it is really important. Cultivating sort of a sense of optimism in our kids through kind of gratitude, doing things for others, that sort of thing is really important, because that helps them to, or helps all of us really, because all these principles apply to all of us, to see those possibilities on the other side of challenge and to kind of, help to make those a reality, that sort of thing. So those are just some examples. Motivation is very important. Intrinsic motivation, sort of from the inside out, sort of to drive towards a goal, particularly when that goal is hard to reach or things don't go well up front. But really relying on the intrinsic sense of motivation as opposed to all of the accolades and pats on the back from the outside. Because if too much of that is happening up front, kids truly, I believe, won't be prepared when the time comes to, face a challenge head on.
It's interesting you're talking. I love what you're saying. And it's interesting to talk about this now because I feel like any educator that I know talk about how like this is even more challenging in the next generation than back in our day. But kids seem to be more afraid to fail. They seem to, like get really scared of going out of their comfort zone, and it's really hard because then parents, when you see their kid in distress, want to just like protect them and shelter them and make them feel safe. How do you tell loved ones, like parents of kids, when that person is trying to get out of their comfort zone and they're distressed, like, no, 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 I can't do this. I can't do, it's too scary. Help me. What do you do?
Yeah, it's a real question, right? And, developmentally, it's going to differ based on where a kid is. But let's say that a kid can engage developmentally in sort of a conversation about it. Sort of first thing, acknowledge the experience of fear, acknowledge the experience that this is not comfortable, but then encourage small steps forward. Encourage them to think about, this might feel really scary, but how am I going to feel on the other side of it? That sort of thing. And sort of try to come at it from that perspective, because oftentimes the fear is much worse than the actual experience, right? Of doing that thing that we're so incredibly afraid of. I'll give you an example with my 15-year-old son just recently. He had to do a swim test for this crew program that he's just started. And we went to the pool the first time, and he hadn't been swimming a lot, with the exception of just messing around with friends in the pool like a couple times during COVID. And he failed the float test. And it was one of those things, and it wasn't completely unexpected, but it was still a blow to him. And he had a week left to make this happen. Went back to the pool the next week, and we got there, and the kind of protocol had changed, and the lifeguard was like, he's a minor. He needs to do a swim test before he does the float test. And my son was like terrified. He was like, oh my God, okay, blah, 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 blah. And I looked at him and I was like, dude, do your best. It's fine. Like, you know what? Here's the deal. Doesn't work out today, we'll come back tomorrow. And he was like, okay. So he goes down to the other end of the pool, fully clothed, because he had to do this thing fully clothed because it was anyway, it's a float test. It's just the way they do these float tests. So he just swim these 4 laps in his clothes. It wasn't pretty, but he did it, right? He did it. And then he had to come down to the deep end and do the float test. And we had practiced, like, okay, what's this going to feel like? Last week, how'd you do it? How'd you approach it? Had him think about that. He was like, well, tried to tread the whole time and it didn't work out. I was like, okay, so what can you do now? He's like, well, I can try to float. So it's kind of engaging them in the process of shifting gears and what it's going to feel like, what it's going to be like to try again, and giving them sort of the okay that if it doesn't work out, we'll do it again. It's fine.
Yeah.
And also modeling, because I've done a lot of modeling with them. I've got 15-year-old twin boys, a lot of modeling about the things that have been hard for me, about the points where I've, maybe not succeeded the first time out. And guess what? It's okay. And so that kind of a thing. And he passed the float test the second time.
Nice.
And he was super excited and felt so good about himself that he had faced that fear on both levels, right?
Yeah.
The swimming those 4 laps fully clothed, he was convinced. I was like, dude, just go. And then the float test. And so I think there's so much value in that as well, just pushing that step forward, helping the kid to take that step forward. And then the power on the other side of that can be so great. And also, if it doesn't work out, trying again, because I can tell you from experience and from perspective, looking back, 30 years, that the points where I had to try again, had to do something more than once, really did benefit me. And by the time I was in my early 20s or what have you, and I hit some challenges, it was no big deal. My peers who had had everything come much more kind of smoothly and easily struggled much more in their 20s or beyond.
Yeah, it's interesting because I'm listening to this and I'm like, okay, to take challenges, to risk failure, it takes self-esteem. And I would imagine self-esteem is the very thing that gets so damaged, especially, if you don't feel like you belong or if something changes really quickly. And then if you get the push to start doing these things, that's also how you build self-esteem. So it's kind of this catch-22. So I appreciate you telling like how some ways that you can kind of push them into that initial cycle of, okay, I'm going to risk failure, I'm going to do that. And then it sounds like not only is there something on the other side for those who take risks and risk failure, but it sounds like there's actually, for people who may have initially felt really held back, there might be some extra rewards, like resilience at the end of the day. Yeah.
Exactly. At the end of the day, and looking back and with perspective, right, that resilience builds over time. But those are the foundational sort of catalysts for that resilience to emerge.
Yeah. So taking the stinger out of failure is a big one.
Huge. Yeah, because I really do believe, and there's a lot out there in the literature too, that failure is one of the biggest catalysts for overcoming challenge in the long run, being resilient in the face of challenge.
Any insight on to how to manage something like chronic pain, like something that is just with you, distracting you all the time, and how to be resilient? And even if you have the same skills that you did before, but it's just this thing that's
so
just
hard. Yeah. Oh my goodness. Yeah. Again, no easy answers, but this idea of managing your stress response and finding a way that you can sort of quiet your mind in the midst of or in the context of the pain is one strategy that I've seen be quite helpful to kind of distract your mind in various ways. Strategy that can be quite helpful, but no easy answers, finding ways to move outside of the experience for short bursts over time is something that but it's much easier said than done. There are no easy answers.
Well, I think I'm out of questions. Kibby, did you have anything?
This has been fascinating. And I really love this emphasis on what I'm hearing is, adding mastery to the feelings. Because I know that feeling comfortable, feeling like safety or lack of distress or just like enjoyment might feel good, but the other positive emotion you could add in is mastery. Like I failed and I did it again and succeeded. That's a feeling that we should encourage, and it's a big driver of resilience. So
yes, absolutely huge. And I'm seeing that play out with my 15-year-old son right now. Actually, he's started the crew program, and things are going really well. And it's not easy. It's a tough sport, what have you, but he's doing it, and it means a lot. And I think it's going to benefit him greatly as he moves forward.
So I guess I'm not out of questions. Do you see people who have been, disabled in some way, becoming specialists? And I mean that by like, you became a really good tennis player, and I know now you're a golf player. I can see, it's almost like when you put constraints on creativity, that's when it can truly blossom. Is that something you see at all, or am I just imagining?
Yeah,
silver linings.
It absolutely can. It's again not a one size fits all. Perhaps somebody in my position would have become a musician and an artist and a tennis player, but for me it just was more of so I think it's dispositional in a sense, in terms of what fits that person.
Yeah. Okay. I just don't have that disposition. I want one. I want it.
I love it. Nice.
I was wondering if you have other resources, like either books that you've written or any other kind of resources that would be helpful for loved ones who are in this kind of situation,
including your own.
Yeah.
Right. Well, yeah. So I've got my book Bounce, Help Your Child Build Resilience and Thrive in School, Sports, and Life. And that outlines the 7 pillars of the resilient child. But the cool thing is those pillars apply to all of us across the lifespan. And I'm working on another book right now called The Resilient Parent. And it's going to have these pillars from a slightly different angle, but, I think really an important topic. So that's sort of, and I've got a website, katelundspeaks.com, with a bunch of different information, and actually a course that outlines a lot of this stuff for parents, along with a workbook. So those are sort of the resources at this point.
So if you all would like to reward Kibby and me going out of our comfort zone and starting this podcast and eventually, in my opinion, building mastery, please give us a 5-star rating on Apple Podcasts and Spotify, rate, review, and subscribe. And Dr. Kate Lund, thank you so much for joining us. Please check out her book and website. And I learned a lot about a topic I know very little about. So thank you for joining us. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.